Hi, welcome back. Let's talk about vaginal discharge in pregnancy today. Is it common? Very common. What happens in pregnancy is that regular normal discharge can get a little more, which is very normal. And towards at the end of your pregnancy, just before your labor, a few days before your labor, it may increase even more, and you may start losing what jelly kind of a discharge. What is it called? It's called show. What it is just a plug which is plugging inside the neck of the womb. As the neck of the womb is getting ready to go into labor, the plug is coming out. That's what we are seeing. That's perfectly normal, not to worry. What are the abnormal ones that we are worried about? The pregnancy itself increases the risk of having thrush. So what is thrush? Thrush is a fungal infection. So how do you know you may have it? It causes a lot of itching. It can give a white, thick, curdy or cheesy kind of a discharge. It's very easy to treat it. Go and meet your gynecologist. They will treat it and also tell you how to manage it so that you don't get it very often. What are the other kinds of discharge? Discharge could be smelly. Discharge could be fishy. Discharge could be yellowy, gluey, blood-tinged, brown, or frank blood. So if it is infectious one, smelly, yellowy, anything different from your normal discharge, then yes, we do need to see you. See if it is infection, then we need to treat you appropriately. What happens if we don't treat it? Some infections like bacterial vaginosis, you may not even know that you have an infection. The symptoms are very mild or none at all. But if we know that increases the risk of you going into preterm labor, that is labor very early on, when the baby is not mature enough to live outside. So that's a worry. That's the reason why we should treat it. Some of the other infections, if it's spread upwards, then it can make you feel very, very unwell and might also do the same for your little one. And hence, it's important that we pick up these infections early on and treat it appropriately. And once it is treated, you will be perfectly fine. If it is, however, brown discharge or a bloody discharge, then we are a little more concerned about it. We do need to see you sooner with these kind of things to see why you're having this blood coming away. Depending on why and what it is, we will investigate you and then we will find out the reason. And if we need to treat you for that, we will do the same. Okay. I hope I have educated you enough for this topic. See you soon for the next topic. Bye-bye. Take care.